So thank you very much. My name is Dr. Chege Mbiu from Arrow Dental, and we are here today as a facility in partnership with other stakeholders to celebrate World Oral Health Day. We are happy to be here in Kibra to support our fellow Kenyans, those who may have dental challenges. One, to provide education or oral health education to empower them to be able to take care of their mouth. They are not carrying any cost. It is a free camp, free treatment. We are happy to have partners who supported this event, and they are here, including the KDF, the Ministry of Health, the Nairobi County Government. So it's a free camp, free treatment for the people of this area, which is Kibra.
My name is Dr. Murioki PJ. I am the Chief Dentist for Nairobi City County Government. We are here to celebrate the World Oral Health Day. Now, if you look at the research, and the reason why we want to insist on this, the research by the Ministry of Health, which was done some time back, shows that 98% of people, of the population in Nairobi and our country at large, have at least one or two unresolved dental issue. That is a very high number. In fact, I want to say that oral health diseases are the most common non-communicable diseases in the world. Like I said, oral health has been neglected for a very long time. Before 2022, before the current government came in Nairobi County, we only had 16 dentists in our public facilities serving a population of 5 million people. That's a very small number. You know, it's even unimaginable. But I want to thank the current administration because since they came in, we were able to hire an extra 50 dentists who have bolstered our efforts to have these services accessible in our health facilities. So this is the first time since devolution that we've ever had dentists hired in Nairobi County. And my appeal is for our people. We've seen a lot of quacks masquerading as dentists in private hospitals, especially in these informal settlements. And we've even had cases of death arising from unqualified people treating patients illegally. So my appeal is that life is very important, and teeth can actually, a procedure on your teeth done wrongly and in the wrong hands can actually be fatal. Please use public facilities in our county, because at least you know that you'll get qualified staff and you'll be able to get these services at the right threshold.
To commemorate this important day, the World Oral Health Day 2026, oral diseases are largely preventable. We really have big plans to have outreaches to reach as many, especially the children who are our future tomorrow. If we can manage to educate them on how to prevent these diseases, then we are assured of disease-free adults in the next few years. So we have plans in place to have a lot of visibility. You saw what happened in Kawagware. It was very unfortunate. So we do not want to lose lives to what is preventable, or to have public seeking care to persons who are not well trained. So you are going to see visibility of the profession in the next future.
Oral health care has been neglected in the country, and this is not right. The Director General is aware and is making efforts to have the universities increase the amount of dentists that are being trained, because we need dentists in the country. We need dental assistants, we need community oral health officers to continuously provide oral health care services. So without an adequate amount of workforce, we are not at a better place as a country. We are also cautioning the members of the public that whenever they're accessing services, they must go to qualified professionals. They should not be seen by quacks who are out to extort them and make money from their needs. That is not allowable. Whenever you go to see a dentist, always confirm that the person who's attending to you is a qualified dentist. The dental clinics are all registered, and the persons practicing in those places have licenses from the regulator, that is Kenya Medical Practitioner and Dentists Council. So imploring the Council of Governors to have employment conditions being improved by having dentists, assistants, and community oral health care officers being employed to provide services at a cheaper and accessible manner, because that is important. Private services have been said to be expensive, but in the public healthcare, if the infrastructure is improved and if we have enough persons being employed, we'll have accessible dental care services. We are further speaking to SHA. The fact that SHA is not covering oral healthcare services, SHA should revise their benefits and consider to include a basic essential healthcare package for the persons in Kenya who are contributing to this social health insurance fund. Because without that, Kenyans are exposed to expensive costs, and whenever emergencies strike, they don't have to really suffer because the preventative aspect and the curative aspect has not been factored into the SHA coverage. So SHA must consider to include dental care services in dentistry.
Maana yako ndio hii hapa. Yote. Kisha unakula kabla ukunywe dawa Hiyo ingine unaenda hapo mbagani. Sasa basi. Sasa kitu nje. Lakini ndani usikie.
Sawa. Vale.